welcome to today's Center for Healthcare Strategies webinar on the critical role of dads, exploring the benefits of father-friendly pediatric care, made possible through the support from the Robert Wood Johnson Foundation. My name is Hannah Gears, and I am a Senior Program Officer from the Center for Healthcare Strategies, and I am delighted to welcome you all here today. At the end of today's session, a brief online evaluation will pop up on your screen, and your feedback is very important to us, and we hope that you will take a moment to complete this survey. As you all likely know, this webinar is the first in a two-part series on expanding patient and family engagement to improve pediatric care that will highlight the value of co-creating equitable partnerships between patients, families, communities, and multidisciplinary care teams. During this webinar, our speakers will explore the importance of intentionally incorporating fathers and father figures into children's healthcare, something that's not necessarily often on providers' radar, not at the fault of the provider, of course, but more so due to societal and structural norms and learned behavior. We can go to the next slide, please. Now I'd like to share a little bit about who the Center for Healthcare Strategies is. So for those of you who aren't familiar with CHCS, we are a nonprofit organization that focuses on policy design and implementation nationally. We work with partners from all backgrounds, including patient and family advocates, policymakers, medical care teams, and many others, with the shared goal of strengthening healthcare delivery, particularly for those who face serious barriers to well-being, like poverty, complex health and social needs, and systemic racism. On the next slide, I will walk us through the agenda for today's webinar. So first, I will provide a brief overview of the Accelerating Child Health Transformation Initiative, the project that was the impetus for hosting this webinar series. Then Lewis will share some of the factors that so often impact the way that fathers and father figures are treated in healthcare settings, as well as some opportunities for expanding the inclusion of fathers. Then we will hear from two representatives from the Pediatrics Northwest Clinic in Washington State, who will share their work related to engaging fathers in clinical practice. Ann Stone will then round us out with a systems perspective for designing father-inclusive care. And finally, Morris Parr, Kevin Cox, and Luis Mendoza will join us in a panel discussion around their personal experiences, both as fathers and father figures themselves, as well as the ways that they have learned from fathers during their many years of father engagement. Next slide, please. So the panel will focus on Morris, Kevin, and Lewis's experience and expertise, and there will be an opportunity for folks on the line today to ask questions of them. So please submit any questions that you have using the Q&A feature, which is shown on this slide here. So you should be able to find it at the bottom of your screen. Next slide. So now I would like to introduce you to today's presenters. So as I mentioned at the top, my name is Hannah Gears, and I'm a Senior Program Officer at the Center for Healthcare Strategies. I am truly humbled every day to work with the presenters on this slide, some who I work with very closely and some who are a bit newer to me. So first we have Luis Mendoza, who serves as a family advisor for the Accelerating Child Health Transformation Project. He actually recently retired from his position as a manager at the Washington State Fathers Network, where he supported men who have a child or children with special healthcare needs. He serves on several advisory boards and steering committees, including serving on the newly established National Parent-to-Parent Father Engagement Task Force. Mary Ann Woodruff is also with us today. She is a board-certified pediatrician who has been in practice for over 30 years in Washington State at Pediatrics Northwest. As you listen to her speak in just a bit, you will instantly be able to tell that she is so passionate about all of the work that she does, including behavioral health integration and the pediatric primary care environment. Among other accolades, Mary Ann co-founded the Reach Out and Read program in Washington State in 2007, and she continues to serve on their national advisory board. Also representing Pediatrics Northwest, we have Rachel Letary, who serves as the Director of Care Coordination, where she's working to build a community health worker division and supports effective teams of care to ensure they are best set up to serve and walk alongside families in the primary care environment. Ann Stone, who has over 30 years of experience serving as a child advocate, will also be sharing her insights with us today. She is the founder and director of the Washington Fatherhood Council, where she works to amplify the voices of fathers and father figures in Washington State, to promote fatherhood inclusion, equity, and diversity, and to better understand what strengthens families and maximizes children's potential. We also have Kevin Cox, who has been working with children, teenagers, and families in the Essex County, New Jersey area for over 15 years in various capacities, ranging from academic environments to residential and community settings. He currently serves as the program manager for the Fellas Fatherhood Program under the hub of the Partnership for Maternal Child Health of Northern New Jersey. Fellas stands for Fathers Empowered to Learn, Lead, and Achieve Success, a program that you'll hear a bit more about during our panel session. And finally, Morris Carr. Morris also serves as a family advisor for the Accelerating Child Health Transformation Initiative, but his full-time work is as the men's health coordinator at Access Community Health Network in Chicago, where he engages male participants in the Westside Healthy Start program and helps to connect them to medical care for themselves and their families. And he has a particular focus on supporting dads throughout the mother's pregnancy. So we have a pretty stacked team of presenters today, and we're really looking forward to it. We can go to the next slide. So as I mentioned earlier, the presentations you'll hear today are linked to the Accelerating Child Health Transformation Initiative, which our team often abbreviates to ACHT. This project began on the foundation that the current child healthcare system fails too many children, especially Black, Indigenous, Latino, and other children of color, and recognizes that health is not impacted just by medical care. It's also influenced by connections, by community, by access to food and housing, and many other social needs. ACT is convening leading experts, pediatric providers, and family advisors, many of whom are on the call today, across the nation through a learning community of 11 pediatric sites who are piloting unique approaches to change. Next slide, please. Through insights from subject matter experts, including those with lived expertise, CHCS has identified 3 key strategies that are integral to child health transformation. And those are adopting anti-racist practices and policies to advance health equity, co-creating equitable partnerships between patients, families, and providers, and identifying family strengths and addressing health-related social needs. And as we've explored these topics over the past few years, we are constantly reminded that there are intersections between each of these strategies. And these intersections often come in the form of the identities that we hold. So today's webinar will explore not only how fathers and father figures can be intentionally incorporated into these equitable partnerships, but also how the identities of fathers shape the way that they are perceived in the pediatric healthcare space, and the constant importance of anti-racism, including when engaging with fathers, because we all know that Black men, for example, are perceived in a very different way than white men, and teen dads may be treated differently than those, say, in their 30s or 40s. If you're interested in reading more about these strategies and suggestions for implementation, we will drop a link in the chat with a report that goes into some more depth. We can go to the next slide. So over time, as we've worked with our pilot sites and our advisors, we have become more and more clear that putting patients and families at the center of decision-making is really key when looking to improve care, which is a big element of that second strategy that I just mentioned. You'll see some examples of how to do that listed on this slide, and I'll walk through a few of them. So first, engaging patients and families meaningfully throughout the transformation process is so important. And it's important to engage them from the beginning, rather than going through the process of developing a policy, for example, and then asking a family for input at the end. The second is valuing patients and families' time by compensating them, which is very important, but unfortunately, compensating patients and families has not always been standard. We're also deeply committed to disrupting power dynamics. And one way that we are doing this within the ACT project is really empowering patients and families to co-lead transformation efforts alongside pediatric medical teams. So that's a little bit of an overview about the ACT work. And again, we will share another link in the chat for some more information. But if you're interested in continuing to learn alongside us, please check out the CHCS website for more resources. And now I would like to turn it over to Luis Mendoza, who I was lucky enough to collaborate with in designing today's webinar. He will be providing context for how and why fathers often feel their voices are not heard and offer suggestions for improving engagement of fathers in practice change and policy development. Louis?
Thank you, Hannah. Hello, everyone. Thank you for joining us today. As Hannah mentioned in her introduction of me, my latest work was with the Washington State Fathers Network, where I supported men who had a child in their life with a disability and worked to elevate the voices of those men. I'd like to start out by sharing a quote from the poet Pam Brown. Slide, please. It goes like this: "Dads are most ordinary men turned by love into heroes, adventurers, storytellers, and singers of song." I'm sharing this because it helps me visualize the transition that takes place for many men when they become a father. And it reminds me of a key point I learned while working with men. That is that most men want to be good fathers, work at being good fathers, and consider fatherhood as important to their identity. Slide, please. In the time that I have, I'd like to discuss the challenge of engaging fathers, why that engagement effort needs to be made, personal and societal perceptions of fathers, excuse me, and some ideas on how to engage fathers and make them feel welcome. Before I get into all of that, I want to mention one topic that may not be covered well in this webinar, but which your practices need to keep in mind and address. That is the culture and language of the families you work with and serve. I'm sure that many of you work with families from different cultures and whose first language is not English, and could speak on the additional challenges these factors might bring to engaging fathers. So although we may not discuss them extensively today, I hope these are issues that you consider, learn about, and discuss with your staff and the families who come to your practice. Slide, please. While working with, back up one slide, please. Oh, thank you. While working at the Fathers Network, another key lesson I learned was that it's not always easy to engage men. It's something that I struggled with and that I know other agencies who serve fathers or families also struggled with. There is no one good reason as to why this is the case. Reasons and theories range from societal expectations and messages men receive while growing up about what their role should be in a family, to the quote unquote nature of men, to work obligations, family schedules, and institutional biases, amongst others. Whatever the reasons, the difficulty does exist. So I think it's important to recognize that whatever efforts you make to engage fathers may result in some level of frustration for you and or your practice. But the effort of doing so and doing so for the long term is vitally important, and here's why. I mentioned that one of my focus areas in my work was to elevate the voices of the men that I supported. This was because I learned early on that systems of support for children and their families is very mom and child focused. So as I worked with service providers, I would often make the point that if you're only hearing from mom about issues related to raising a child, then you're only getting part of the story. And I think the same is true of pediatric practices. If you're not tapping into the knowledge and perspective of the father about issues related to the health of their child, then you're only getting part of the information that you need to provide the best care possible. So I'm hoping that what you hear during this webinar will get you started on making an effort to connect with fathers or reinforce the importance of the effort that you're already making. So let's talk a bit now about the differing perceptions of fathers. And it would be great to have a conversation about this, but given our format and our time, I'm simply going to say that when asked to come up with words that they would personally use to describe fathers, what are mentioned are often words like you see on this next slide. Words like loving, playful, protector, important, support, and role model. But when the question is shifted to come up with words that people think reflect our societal perceptions of fathers, it often results in words like you see on this next slide. which would be words like absent, provider, disciplinarian, strong, breadwinner, and deadbeat. So that's quite a shift from words that people use to personally describe fathers to words that they think our society uses to describe fathers. And it's this societal perception, which at least for me, leads into and feeds the perception that men are too busy and or uninterested to take part in issues related to the raising and health of their children. Fortunately, things are changing. And as someone who was a stay-at-home dad for over 10 years and who has worked with lots of fathers, I feel confident in saying that men want to take a more active role with their children and that society is becoming more and more accepting of having that happen. The very fact that we're having this webinar indicates that we're moving in a positive direction. But still, our institutions are not moving fast enough to keep up with this change. Efforts need to be made to change how organizations think about fathers and think about engaging them, how they are set up to do that, and how they allow their staff to do that on a personal level. So while there are some ideas, so I want to offer some ideas on how to engage dads and have them feel more welcome in your practice. And I'll start with what I'll call the low-hanging fruit. Slide, please. Not every appointment is going to require both parents, but when you have both, please don't just defer to mom. Talk with dad. Ask him questions, get his opinion, and generally do what you can to get him involved in the conversation. If you have photos in your practice or in your office space, especially if you have photos of moms and moms with kids, then you should also include photos of positive, diverse images of men and men with children. Have chairs that fit adult bodies, especially a larger male body. It's amazing how far it goes when you make someone comfortable, how far it goes towards making them feel welcome. Have changing tables in all the bathrooms. Have magazines in your lobby that are of interest to men, or at least appeal to a broad audience. And make sure that receptionists and other staff don't assume that mom is coming. I've been told by dad after dad about their experience going to appointments and the appointment not starting because there's an assumption that we're waiting for mom. So at a minimum, just have your staff ask a simple question like, will anyone else be joining you for today's appointment? I also wanted to mention a couple of tools that you might want to look at that may give you a gauge on how father-friendly you're being. Online, you'll find things called father friendliness surveys. The one that I see people using a lot is one offered by the National Fatherhood Initiative. It's a rather lengthy survey, but it's broken down into pieces and sections, and you probably can use it by only using some parts of it. Father-friendly principles provide guidance on what service providers, organizations, and policymakers need to do to strengthen father-friendly services and systems. There are probably more of these than I'm aware of, but the two that I am most familiar with are the ones established in Alameda County in California and by the Washington State Interagency Fatherhood Council. And as Hannah mentioned, you'll be hearing shortly from Ann Stone from that Fatherhood Council, and I believe she will talk about those briefly. Slide, please. Now I'll briefly touch on some deeper issues. Earlier, I mentioned that it can be difficult to engage men and that some of that may have to do with societal expectations and the messages that men receive as they grow up. I want to talk about this a bit and how these things might impact the way fathers and staff interact. I know that there are exceptions to what I'm about to say, and as I've mentioned, some societal expectations and perspectives are changing. But for many of the men I've worked with, these things apply, even for younger men. These messages I'm referring to are things like don't show weakness or fear, don't ask for help, make decisions, be a problem solver, and provide for your family. Some of those messages can impact the roles men take on as fathers and how they interact with caregivers. As an example, having received those messages, it can be difficult for a father to ask for help or even to respond to a question like, how do you feel about that? A father may need extra time to answer such a question because not only do they have to figure out how they feel, they have to figure out how to express that feeling, two things that may not come easily for them. So their lack of response or slowness to respond should not be taken as denial, lack of interest, or being out of touch. And very briefly, because I realize I'm probably short on time, I want to mention that in general, there can be differences in parenting styles between moms and dads. I'm probably preaching to the choir with that statement, but it's worth mentioning because neither way of interacting with a child is the only correct way. Both ways offer benefits to the child. And those who are working with families should not assume that mom's way is the best way. I bring this up because fathers will mention to me that their way of parenting is often not validated. So to wrap all this up, if you want to successfully engage with fathers and make them feel welcome, they need to be acknowledged for what they bring to the parenting role and asked what they have learned and observed about their child in that role. As I said at the start, men want to be good fathers, and they are willing to work at being good fathers. So let's do what we can to recognize them in that role and engage them in that role. And with that, I will turn things back to Hannah.
Thank you so much, Louis, for sharing your expertise with us today and for sharing such an important call to action that we all need to hear. Although I do think that based on our list of registrants that I was reviewing this morning, many of us are fully bought into the importance of fathers and father figures. But Louis, we are looking to hearing more from you during the panel in just a bit. I will now turn it over to Marianne Woodruff and Rachel Lettieri from Pediatrics Northwest to talk about their efforts to intentionally include fathers in pediatric care.
Thank you, Hannah, for your kind introduction and to the Accelerating Child Healthcare Transformation team. And also to you, Louis, we always learn from you and really appreciate the perspective you bring of inclusion of fathers. Oops. I'm having trouble advancing. Maybe Emily, I'll have you advance slides for me. We go to the next slide. It will not, sorry. Thank you. So Rachel and I are here today to share some of what we've termed a journey to inclusion. We humbly accepted this invitation to tell about what we are doing, weaving a story of transformation, not arrival, of commitment, not completion, of continually learning from and with parents, and at its essence, a journey of inclusive partnering. This is not a linear story. It's one of serendipity, determination, and is a work in progress. Next, please. Pediatrics Northwest was founded over 45 years ago by Doctors Larry Larson and George Tambera. Equity principles have guided us from the beginning, reflecting, and I've been reflecting on Dr. Tambera's legacy. He was a dedicated community leader who himself had experienced the utmost exclusion, having been sent to internment camps during World War II as a result of FDR's executive order, even though he was an American citizen. He envisioned a medical home model from the outset, and we continue to hone his vision. Our practice is fortunate to be part of the ACHT pilot with the goals of adopting anti-racist practices, co-creating equitable partnerships between families and providers, and becoming adept at identifying both family strengths and health-related social needs in order to promote resilience. We have plenty to learn. Our eyes are open to possibilities of authentic partnerships with fathers, mothers, caregivers, paying particular attention to who has not been included. We talk about transforming the care we deliver. It starts from the beginning, as far upstream as possible. Here are the principles we are trying to achieve of a high-functioning medical home: family-centered, ultimately driven, equity-based, community-connected, accessible whole-person care with a team approach and a public health lens, where families are connected to services and resources that they both want and need, with the onus being on us to connect. These goals are embraced throughout our practice, from our busy schedulers to our CEO. Well, what does this have to do with fathers? Everything. In total honesty, we haven't always paid the right attention to mothers. And now we are determined to pay attention to, as Yuri Bronfenbrenner, the co-founder of Head Start, noted, those adults who have an irrational, emotional relationship with the child, the somebodies who've got to be crazy about that kid. That's number one, first, last, and always. We are paying attention. Next, please. So our goals have been to start at the beginning. We want all family members to feel welcome. First, in the space of the medical home. It starts with phone calls and walking through the door, how one is greeted, the eye contact we make with everyone, eliciting the concerns of all parties. It doesn't stop there. We want all parents and caregivers to know that they belong and that they matter. This takes attention to details and not one size fits all. Thank you. The list you see here are just some of the ways we do this. When we give books through our Reach Out and Read program, we make sure that the books are both windows and mirrors for the children and their families, with representations of all kinds of families. For example, Hair Love is an outstanding example of a book about the relationship between a father and his daughter. Next, please. We've learned and continue to learn that a reflective stance in the exam room is so much better than a directive one based on laundry lists that I bring. How many fathers have wondered why they were even at a well-child appointment with their newborn other than as the transportation if they were not specifically drawn in or even addressed? And all along, they are completely essential for the development of early relational health, that ability to develop and maintain safe, stable, and nurturing relationships, the buffer to the inevitable stresses that all of us experience, and the source of positive childhood experiences and joy. How different it can feel if we model and call out relational well-being. Simple comments of reflections to dads. Look at how your baby calms when you talk to her while I'm doing the exam. We draw the parents into this circle of caring, not as observers, but as equal participants who want to support and understand this tiny human. Next, please. If we value children, then we must cherish their parents. Sir John Bowlby, the founder of attachment theory, says it all with this statement. We must do that at the practice level and at the societal level. Cherishing parents means attending to their health and well-being. It means them having time to spend with their newborns. Washington State, where we live and work, has also taken an important step, paid family leave, for 12 to 18 weeks postnatal or post-adoption for either or both parents that can be taken anytime during the first year of life. No more going to examine a newborn at the hospital where I say a quick hello as dad is heading to work. Feeling peripheral. With paid family leave, dads are being told directly that their presence with their infant in these first critical weeks is important, that they are needed as the nurturers that they are. A father recently shared with me, with his first child, there was no paid family leave available. It was prior to the program. And now to have had this past 2 months off, he said, it's the longest I've ever had off from work since starting work, and has made such a difference. Not having this time with a newborn reinforces role stereotypes. Next, please. So cherishing parents also means listening to parents. The comments here are from focus groups in Oregon, from men and women. They hit hard to this sometimes harried pediatrician. Our promoting first relationships learning teach us to take a breath, take a moment prior to going into the next exam room, realizing that they're in as a family who is bringing their hopes, concerns, worries, and their most precious child to you. Next, please. So notice when the American Academy of Pediatrics called on pediatricians to routinely screen parents for postnatal mood disorders. And we are careful now to say postnatal instead of postpartum. Our choice of words matters. Sadly, the screening across the country is well under 50% of mothers and only a fraction of fathers, despite robust evidence base that screening plus connecting parents to desired services works and therefore improves the relationship with one's infant. Next, please. The well-being of each family member matters. This is really a human issue, as important for fathers as it is for mothers. And you can see that there are documented rates of postnatal depression for both fathers and mothers that is really high. Next, please. So at our practice, we chose to screen for perinatal mood disorders with the Edinburgh, which is a validated tool for both fathers and mothers. We didn't undertake this lightly. We've done it with caution, care, and really love. Pediatricians are doers who have a difficult time with the admonition, don't just do something, stand there. In really solidarity, recognizing what developmental pediatrician Dr. David Willis reminds us, what is shareable is bearable. Do we dare screen before we have all the requisite answers, workflows, where to start? And we took that step and now we screen routinely. I'm gonna go back one slide, please. Oops. Maybe back 2 slides. Oh, stop right, thanks. So what should families expect when they fill out the Edinburgh? Centrally, to be seen as experts in their own lives, the lives of their children, and we are simply co-journeyers. Next, please. So when we're setting the tone for these successful screenings, notice some of the bullet points, especially the latter ones, that we ask all families to do this. We don't just choose some families. And it's certainly been interesting that when dads bring their children in for one of these visits, they assume that the Edinburgh is not for them, that it's only for moms. But when I ask them if they would mind filling it out, rarely would they decline. And we allow for them expressing their true feelings in this is not an easy time. Is this a joyful time? Likely. Is it stressful? Definitely. And babies can seem quite fragile to them and actually don't come with operating instructions. Next, please. So this is just a glimpse of the kinds of words that we've heard from both moms and dads. The very last comment is from one of the dads of my patient. And when I asked him to do this, to fill this out, he just threw his arms around me and he thanked me and said, you guys always do the right things. One of my colleagues shared that 2 dads who had flown to Washington State to meet their adopted daughter saw one of my colleagues for about the first 2 months of the baby's life. When they were each asked to fill out the Edinburgh, they cried. For them, it was a sign of respect that their well-being mattered to my colleague, to the health of their daughter, and that they were in fact respected as parents. Next, please. There are always barriers, and with barriers come opportunities. Persistence pays off. We are addressing these barriers one at a time until we're able to routinely screen not just one parent, but the caregivers of all the caregivers of that infant. The words we use, as Lewis mentioned, can be a barrier. One of my colleagues, a dad and pediatrician, reminded me to say this today. Can we stop saying only moms when what we mean is parents? Several other dads this week expressed surprise at being even asked what they would like to be different at our practice for them as fathers. One commenting, I've been taught since a young guy to hold in my feelings. And then he talked about his journey as the dad of his newborn. Next. And with this, I'll turn it over to Rachel to talk about 2 other endeavors that we're doing.
Thanks, Dr. Woodruff. You can go to the next slide. So one of the endeavors that we're doing at Pediatrics Northwest, and as Dr. Woodruff has mentioned, this is a journey. We do not have all of the answers and have it all figured out. We are learning as we go, but the intentionality is there and we're hoping is present. We have community health workers that have just started across all of our clinics in July, and the intentionality behind them is to create teams of care, utilizing them from the start. And having them be able to accompany families. The focus of these community health workers is that they'll be focusing on families perinatal to 5. And that area really focuses on kind of that connection after the postnatal depression screening that Dr. Woodruff was talking about, ensuring that families are connected and that there is follow through to resources that they would want, and need right from the clinic. The other area is our community health workers are being utilized for mental health referrals accompaniment, not just handing families lists of resources, but really accompanying them and doing all of that research to ensure that a resource is a good fit, accepts their insurance, so on and so forth. And this area for community health workers, the intentionality behind it is to promote safe, stable, nurturing relationships, mitigate any barriers to care, and then connecting them to the services that the families want and need. Next slide. The other area that we are utilizing at Pediatrics Northwest is in creating authentic family engagement. We are calling it, we originally had started to call it family advisory, and we didn't like the way that that sounded because we don't want to just focus on families advising and providing feedback to us. We want to work towards co-creation with families at the practice. And so we are inviting parents and families to be a part of our committees and our meetings at Pediatrics Northwest, where care transformation decisions are being made. And we are actively seeking out fathers and being intentional about that, to have them be included in co-creating with them as a part of our family partnership team. Next slide. So family voice is an opportunity for co-creation. Having this shift be only from a survey or getting information and feedback from families to actually embed them at the pediatric practices, to have them be involved in committee structures, the important meetings where decisions are being made, and have them be seen as partners. Next slide. And I will leave you with this quote before passing back to Hannah. At first, people refuse to believe that a strange thing can be done. Then they begin to hope it can be done. Then it is done, and all the world wonders why it was not done centuries ago.
Rachel and Marianne, thank you so much for your presentation today. I know that working in healthcare right now is not so easy, and it's hard to not be amazed that you all are still putting in so much work to change the way that you practice. And I can truly feel how much love and admiration that you have for your patients and their families, and the love that you bring into your work. So thank you. Now I will turn it over to Ann Stone, who will join us to outline the positive long-term impacts on children's emotional and economic well-being associated with fathers' involvement in a child's life. And she'll also share a set of North Star father-friendly principles that Lewis mentioned, and she'll go into a little bit more detail there. So I will turn it over to Ann. Thank you.
Hi, everyone. So we're a little short on time, and sadly, I already can talk fast. So forgive me up front for going a little quickly here so that we have plenty of time to hear from our fathers panel. So I have the honor of being one of the founding parents and the director of the Washington State Fatherhood Council, which is a coalition of about 30 partners with a very important element. Always about a third of that group are fathers with lived experience. And I just am going to note for you, as you were talking, Marianne, about images, there are a couple father-friendly photo banks that you can tap into that are free open source images, and all the ones that you see on our slide come from ours. And I gave the link to the center that you could post it for folks. And so it is important, and sometimes stock photos are really hard to get a good image. So So I just wanted to call that out to you. So the, we are definitely, oh, there it goes. It's working. Yay. So I just want to underscore why we're talking about fathers and not just parenting. I know we're speaking to the choir a little bit, but I want to put a little bit of a twist to this. Child and family well-being improves when fathers are positively engaged. I hope everybody on this call knows this, but when you really unpack this, Lewis is talking about, you know, if you have part of the family, you're only hearing part of the story, but sometimes we don't have dads that live with their children, and they maybe are not in such a tight co-parenting pair. And so how we engage those fathers too is important, and that bears on the well-being of their children. So it's a direct impact on your clients' health and well-being. And we've already talked about the fact that fathers play a unique role. I have a few slides in here that we're going to jump over, but you can go back and look at them later around the dance between infants and toddlers and their parents, and and their fathers. It is really profoundly different. And little brains need those different styles of parenting, particularly around social emotional development. So what's happening at the point of birth for fairly high stressed families? We know a lot from a sample that looked at families that were not together and were pretty high stress environments and situations around poverty. And they asked moms, do you want father to be involved? Look at the numbers. Look at how high this is, whether they're living together, whether they're just visiting, or they're in a non-romantic relationship. 99% to 74% of moms said, yep, I want dad there. And then when you look at father's parental acknowledgement, parentage acknowledgement in our state, in Washington, it is very high, about 88%. So moms want dads there, and dads want to be there. But what happened when at kindergarten, only about 35% of them are there? So think about that. Those are all of the years when we have such high touch through Well Child, right? 15 visits in Bright Futures. We have such high touch through other systems like childcare and other places where we're maybe talking to mom, but are we talking about father and connecting father? So that's going to be a head scratcher, because that's not an easy thing. It's part of our comprehensive health history, I hope. It's part of our anticipatory guidance, maybe not yet, but let's think about how it could be. And then remembering from that same study that half of those families were living together. So even though the census calls those unmarried couples, dads are really involved. And I think this is just an interesting one, and Lewis referred to it. I think we think that the fatherhood is more important to moms than to dads, but look at this, it's absolutely dead on. Parenting is very important to both parents' identities. I'm going to jump through these so that we can get to outcomes and what we can do. So those are pictures that show us about the different interactions with infants and different gendered parents, and they're really fun to look at. So go back and grab the slides. But we do need to remember that there are benefits for mom, and everything we do at the Fatherhood Council is child and family and community centric. So it's all to the service of children and their families. So it's never about moms or dads, because that's just not the way families are in the world, and that's not how we want our services to be. But I think one of the entry doors into that is to helping moms understand the benefits for them and for their children. And so it's just good to remember that. We have improved prenatal care. We have reduced infant mortality. We have more successful breast or chest feeding. Actually, I should change this slide. That's really the term that people are using today. And in some places, to accommodate fathers, they've even created milk banks for dads that are non-cohabitating, that they could chest feed their babies with breast milk. And then, you know, prenatal mood disorders clearly are affected when dad is not involved. there's some work that's happening with Dr. Craig Garfield at Northwestern about maybe doing PRAMS data on fathers. For those of you that are familiar with that data, it is the pregnancy risk assessment data that we always ask moms. And wouldn't it be great to know how dads are doing at the time of birth as well? So Dr. Garfield is doing some pilots in several states now with the CDC's support to be thinking about what's going on for father at the time of birth. So we went out and asked dads in 2019 after the council was started, what are your greatest challenges? What are your greatest issues? And no big surprise, their number one answer was more time with my kids. And to really underscore that, we hear repeatedly, assume I want to be involved, don't assume that I don't. And Lewis has already talked about that, and the panel is going to talk more about that. But I think we do often make an assumption that fathers don't want to be involved or are somehow absent, and that's because they don't care. They also believe there are no services for fathers, so it is incumbent in all of us to be thinking about how could we be doing that, and we're going to talk about a few examples here in a minute of ways that we could do that within prenatal and well-child environments, and connected to our other public health efforts like WIC and other places where we have contact pretty regularly with families. Clearly, social stigmas are there in all of our systems. They're actually pretty hardwired. And we also have individual biases that we all bring to work with us, how we related to fathers in our lives, be it our own father, our spouse, a father that's related to us that we have a close relationship with, that carries forward with us. And we may be triggered by that. So how can we be really conscious of that and think about that as we're interacting with people? I had a father tell me the other day, he took his daughter to an appointment with grandma, baby's grandma. He is a sole parent. And he was asking questions of the provider, and the provider would physically turn and answer the question to grandma. And he said, I got so frustrated and I was so hurt and I was so angry because I am dad and nobody valued me. So it's just built into us to react to our situation through the lens of our experiences. And that's okay. We just have to call that out in our own brain and think about how does that influence me and how I'm relating to this individual. And then issues of child support and financial security. And I think the issue about financial security that really plays out is this notion of I am seen as the paycheck, and that's how the culture defines me as a father. I often feel less value because I feel like I can't do that. So if I can't provide financially, if I'm struggling with issues in my own life and I feel like I'm letting down my children and my families, then I'm nothing. I'm valueless. And dads tell us that all the time. If we create the warm, welcoming environment that Dr. Woodruff is talking about, we can turn that around. But that isn't how fathers see these systems that interact with them. They feel very invisible and alone and isolated often. So this comes from the research. I'm just going to put it up here and let you see it. This is from Tova Walsh's work at University of Wisconsin, and it's really kind of a no-brainer around father-focused resources. And as Dr. Woodruff said, talk to him when he's in your exam room or in your waiting room or in your process. Focus your attention on him, and that goes a long way. And then normalizing the frustrations of parenting. This is another one, I think, that men feel very judged. We have a young dad who was substance involved when his baby was born. He and his wife both were, and he's now the sole parent of this little toddler, and she has moments. And so he said, but people look at me when she's having her moment and we're in the grocery store like, what is wrong with you? And where's mom to come fix this? And he feels very judged because we expect that from toddlers when moms are there. We even say, oh man, you know, terrible twos, or darn, can't go out to the grocery store at nap time or whatever. But dads don't feel that way. They express a lot of suspicious looks from people about their parenting. And that's heartbreaking. So I love this image. This is one of our photo bank images, but it really shines the light on the phenomenon and the benefit and the power of skin-to-skin contact around the time of birth. And so I kind of broke down these ideas into developmental buckets, but one of the things Dr. Garfield talks about, and we're actually going to start thinking about in Washington, is there a way to encourage and support prenatal groups for dads? So, you know, dads don't really have a place. They don't have a place to come together to think about what's it going to feel like to become a dad? What are my concerns? What are my worries? What's my hopefulness? What kind of tips can we share with you and with one another? There's a little hiccup in Washington. I don't know if this is state policy or federal policy around Medicaid, that the birthing parent needs to be there. So we'll have to work through some of that, but there are ways, right? There are ways to bring in partners from the community, maybe, that could run a group. Dad doulas, we have 2 in Washington. I know of 2 men, and that's a doggone little number for a state our size. Care coordination. So Dr. Woodruff's practice has a great approach to a very holistic way of helping people connect to resources. How do we think about not home visitors, sorry, we think about that too. How do we think about navigators of our systems in terms of fathers' needs? And maybe we need to have some men in those roles that have navigated these systems. Just a thought. Skin to skin and parents being present through the birth process somehow, particularly for those that may not have a tight relationship between those co-parents, is really important. The sooner dad creates the bond and the babe creates the attachment, the better we're going to be in keeping the 2 of them together. We've already talked about screening. It is very scant. I'm not sure that we even could give any data on that. In our state, I don't know that we disaggregate the screening data by gender of the person that we're screening. And if they're non-cohabitating pairs, how do we even get at dad to see how he's doing? There's a wonderful model called conscious fathering, which is usually a hospital-based kind of 4-hour engagement with fathers with new babies, and they have to come by themselves, and there's a lot of anxiety about that, but it's an ability to build confidence and to create social connection. Absolutely wonderful. I already talked about the dad's milk bank, but just thinking about them as a chest feeding pair, not maternal child and lactation, because having dad involved has positive outcomes all across that process. And then the last one I want to say about well-child care is this notion of in-office and in anticipatory guidance. How do we create an intentional focus? It's kind of like you have to turn on the dad switch, right? You have to think about it differently, because maybe he's not there, or maybe you don't have materials that focuses on his role. But let's think about how we could do that. And so lastly, I was just going to show you, Lewis talked about the father-friendly principles that have been developed by both the Alameda Fathers Corps and the Washington State Fatherhood Council. And I don't have the whole list up on the screen, but it's in your chat. Go ahead and pull that down. And what it does is it just gives you an idea of things, a framework that you can think about around how can I help create a more father-friendly experience in whatever way I touch this system of supports for fathers that's really committed to equity, fairness, and justice. And so it's things like really paying attention to co-parenting, even if they're not together, thinking about who we have in our spaces that have people that look like them, sound like them, have lived what they've lived, thinking about it through the lens of what does training and recruitment look like, and then also what does it look like for mid-career people to go back and learn and think about ways that we could be more inclusive. And then the last thing that I would leave us with is we all come to work with individual biases. Absolutely, that's human. But we also have very hardwired system biases. And so our father-friendly principles really shine the light on that in helping us think about how do we recognize that? Do we have things in the way we set up our data, in the way we interact with our clients, in the way we meet with folks that automatically excludes dads? And I think once we start unpacking that, some of these things are not hard. It's just a matter of turning on the dad switch. So I want to hand it back to Hannah because we have a great opportunity to hear from some dads in our panel discussion. And hopefully we've given you some ideas of things that you can do.
Thank you, Anne, so much for sharing your deep expertise in this area. And really your slides contain such a wealth of information. So I definitely encourage our listeners to go back and review them, particularly the folks who are interested in the science-backed importance of engaging fathers and father figures, in case you're still in the stage of needing to make the argument to others. So really appreciate what you shared today, Anne. So now, as Anne mentioned, we are going to move into the panel discussion. So I will invite Morris, Lewis, and Kevin to unmute and come on camera if they wish. And Emily, you can go ahead and close the slides. Thank you. Awesome. And Morris, I see you're there, so that's great. So we really hope for this to be more of a conversation. So panelists, please feel free to jump in with questions and comments for each other as we go. And to the audience, as I noted before, we should have a few minutes to answer questions from the audience. So please don't hesitate to put any questions you have for the panelists in the Q&A as we go. So I feel like everyone's probably dying to hear from you all. We've had a lot of presentations, but I wanted to start by asking each of you to tell us a little bit about your professional role related to working with dads, and then on a more personal level about your role as a father or father figure. And I'll have Kevin and Morris start, and then Lewis, you already shared a bit about this, so I'll leave you to the end and you can share anything that you'd like. So Kevin, I'll turn it over to you.
Hi, again, I'm Kevin. I've been working with the Fellas Fatherhood program for about 2 years now, where we service dads in Essex County, and we aim just to provide a platform for engagement and needed resources for our fathers. So not to go into it too much, but we have weekly group sessions where we discuss fatherhood topics during those sessions. We also have most popular aspect of our program, which is the couples communication aspect, where we just aim to give basic communication skills and stress effective listening, and that's more of an individualized aspect. But the most important part of our program is our case management, where we have one-to-one connections with our fathers that are engaged with our fatherhood program specialists. We connect them again to needed resources. It's real goal-oriented. And this is, I think, where the meat and potatoes of our program really takes place. As for myself, I'm the product of a single-parent household, but I'm also a stepfather. I've been a stepfather of a 14-year-old, and I've been in his life for about 7 years now. So it's definitely an interesting experience.
Thanks so much, Kevin. I'll turn it over to Morris.
Hey, what's going on? My name is Morris Carr, and I work for a fatherhood program that's embedded in the maternal and child health program. It's called Westside Healthy Start on the west side of Chicago. The program is geared towards decreasing infant mortality, and we, provide case management for the moms and the dads. I provide the case management for the dads. Mostly, our main goal is to get them into care, to get them a primary care provider and healthcare insurance. But we also have goals. You know what I mean? So it's depends on the needs of the father and link them to different resources. My experience as a father, I have 5 children ranging from the ages. My oldest daughter is 12. My youngest is two girls, 3 boys. Yeah.
Thanks so much, Morris, for sharing that. And we won't tell your oldest child that you couldn't remember how old she was.
She would be mad.
Lewis, I'll invite you to share anything that you wanted to share beyond what you presented on.
So I've already mentioned my work with the Fathers Network, which was in support of dads who have a child with a disability. Interesting, as I was thinking about Hannah's question, what popped into my mind is many years ago, I worked in an elementary school and as a paraeducator. And I think it was probably then that I began to see or understand the importance of getting dad's perspective, because we would usually interact with mom regarding their child, but but oftentimes when I would get the opportunity to interact with a dad, it was often enlightening, because they would have a different perspective on what was happening with their child, or what they saw as their hope for their child. So that was interesting back then, and it's something that I think helped me later on in my career. On a personal level, I have 2 adult daughters. As I mentioned previously in my presentation, I was a stay-at-home dad for a little over 10 years, and that was probably 20 to 25 years ago. So being a stay-at-home dad at that point was a bit more rare. So that was it was an interesting experience to go through.
Well, definitely a diverse set of experiences, and really appreciate you all sharing your personal experience as well as your professional. My next question for you all is, since each of you have worked extensively with fathers and father figures throughout your career, I was hoping you could share some things that may help you or the fathers and father figures that you work with to feel valued when engaging with your child's doctor and their medical team. And I also invite you to share some examples of things that may not be helpful, if that helps, kind of illustrate the full story. Morris, I'll start with you.
Well, I'll use a personal story. So basically me and mom, we take turns taking the kids to the doctor. But the youngest two, for some reason, they always follow on my turn. So I always end up going to the doctor with the boys. But after having 5 children from the ages ranging from 12 all the way to 2, like my 2-year-old doctor, his pediatrician, she's the first person that ever remembered my name. And I was just so surprised the other day, and she's like, "Hey, Morris, what's going on?" I was like, "Whoa." She knows my name. Like, that's crazy. I've all the times that I been to different doctor's appointments, and it made me feel more comfortable in that setting. You know what I mean? It made me feel like I mattered, and like she even cared. You know what I mean? And I'm like, it would be nice if I'm trusting the doctors with the care of my children, for them to know my name, or at least ask me my name. You know what I mean? And it's crazy to me that I haven't thought about that over all these years until recently.
That's such an amazing illustration, Morris, because it should be so easy and just like a common human decency to ask the father what their name is, and take the time to write it down in the patient notes. But I totally think that that's not as common as it should be. Thanks for sharing that experience. Kevin, would you like to go next?
Sure. I think to answer the question and to kind of lean into what Morris was saying is, from a lot of the fathers and father figures we work with here in New Jersey, it's kind of a similar sentiment, in the sense of they really just want to be included, and included in a respectful manner, included in a way where they're recognized as relevant parents, and to not really have their position slighted or undercut in any way. It's at times it's offensive when you're treated as if you're someone that needs to be engaged or motivated to parenthood. So I think having a more open perspective on that is definitely going to be beneficial. I think it's important for fathers not to allow the doctors or the medical staff to make presumptions or assumptions that define their parental role, to just, a financer or a transporter. I think, once we get to a place where that inclusion is more regular, and we see it on a more consistent level, I think it'll be beneficial overall in terms of the fathers that are there, but then for the overall family and that medical experience.
Thanks, Kevin. Louis, I'll turn it over to you.
Yeah, I like the points that Kevin and Morris made. Morris's point about having his name used, I think it's just, like you said, should be common practice. And it goes back just customer service. And if you apply the concept of customer service to pediatric practice, in a customer service environment, you would want to do that. You would want to use someone's name a lot, as often as you can. I think it's just a good practice. But something that I enjoyed when I was a dad taking my kids to appointments, and I hear a lot of other dads talk about, is just being recognized as a partner with the medical practice, and being recognized as an expert in my child, which sometimes doesn't happen. And that's unfortunate because parents do have a lot of knowledge. We're with our kids all day long, and we learn a lot about them. And to not have that be to have that discounted or not appreciated or not used as information in that healthcare situation, it's not a good feeling. Anne had mentioned dad support groups. And I just wanted to talk about that a little bit, because that was a large part of the work that I did with the Fathers Network, was providing support groups for dads. And dads, I think, are sometimes hesitant to go to that kind of environment. It sounds, for a lot of men, I think it sounds too touchy-feely. And it would be touchy-feely for me. It's probably not something that I would want to go to. But once I could get dads to that meeting and they could see that there were other people, other men there who had information that was helpful to them as a dad or helpful to their child or their family, they saw real value in that. And they would come back. They weren't necessarily looking to be friends with these other people in the group, but they wanted information that would be helpful to their family or to them. And when they realized they could get that there was great value seen in it. I think it would be nice for pediatric practices to help moms understand, as Anne mentioned, the importance of a father in a child's life. And just, if a mom needs that information, it would be helpful if that could be provided. What are the benefits of involving the father in that child's life, whether the father is living with the mom or not? There are real benefits to having dad involved.
Thanks for sharing all that, Louis. I feel like we have a pretty good picture of what can be most helpful, but I think it's time to make these things common practice, and that requires medical providers and their staff to kind of rethink the way that they typically do business. One other question that I had for you all is, that we've been talking offline in preparation for this webinar about the concept of quote unquote, getting fathers more engaged in their child's care. And I personally was the one who brought that phrase into our conversation. And I think it just shows my learned behavior and my bias that I bring into this space. But I wanted to hear your individual reactions to that statement, getting fathers more engaged in their child's care. And I would love for you all to share that with the broader audience. So Kevin, I'll turn to you first.
Well, I think when I first heard it, I kind of took it as how you described it was kind of a learned behavior, and it's typical of how society kind of engages dads, especially in these type of arenas. So, I always think we should use those moments as teaching moments and learning experiences, and I think that's where the correction should take place every time. We get an opportunity to make that correction and to, just remind whoever's phrasing it or using the phrase that, to an active father, that's somewhat of a slight, to a father that's involved with his child, that is relevant, a father that, is engaged already. It seems as though it implies as though there's something missing and there's something lacking. So it kind of starts dads off on the wrong foot in making them feel as though they're not, an adequate part of even the family structure. Mom comes first, and again, kind of limits our role. So I definitely think when I first heard it, I looked at it as, again, it's just kind of reflective of tradition in society and how they view fathers typically. And, the work that I'm doing, that the Fellas Fatherhood program's doing, that a lot of our panelists and contributors to the webinar is doing, is trying to really break down that history and break down that tradition of continuing to view fathers in that light.
Thanks, Kevin. And I think another thing that just really stuck out in my mind when we were talking about it before was, you said, if the dad is at the visit, he is engaged, he is present, he is there. And it's kind of dismissive to use that language. So thanks for sharing that. Morris or Lewis, did you want to add on to that with your own perspective?
Yeah, I'll just briefly say that, to add on to that a lot of times you'll hear the term father involvement, but you don't hear the term mother involvement. It's assumed that mom's going to be involved, but there seems to be a societal perception that dad isn't necessarily going to be involved. So I would stop using that phrase. It makes an assumption that we're not involved. And the other, I did want to squeeze in one other thing. I think it would be helpful for pediatric practices to figure out for themselves, what does engaging fathers mean to them? So that as they try to do the work, they can figure out whether they're being successful for what they're trying to accomplish. And are you trying to be reactive to a dad's needs, or do something proactive, like establishing a dad support group? And so I'll stop and give Morris a chance.
When I heard involvement, I just had a flashback to all the stuff that I do. It's I'm like, how more involved can I be? You know what I mean? And it's to just to hear that term when you come to those spaces, it's I mean, even if I'm not able to come to every doctor's appointment, I do way more at home. You know what I mean? And it kind of makes you feel like you have to prove yourself, as a parent, kind of. And like Kevin said, it's kind of like a slight, because it's when my mother-in-law, she says all the time, she said, "Man, I just don't know how you do it. You just do so much, you're at boxing practice this day, then you're at home doing homework that day, then you're early in the morning and you're at the gym and you're doing all this." And it's I'm involved, you know what I mean? And it's just because it's a lot that the practices just don't see, you know what I mean, or the people doing the work don't see. Because if I'm working, you know, all the time, is the way that I can possibly be at every appointment, or, you know what I mean, do every program that's available for fathers or for parents or whatever, you know what I mean. But that doesn't mean that I'm not involved. Yeah.
Thank you, Morris. And unfortunately, we are now out of time, but I just wanted to say thank you so much to our panelists and also to our presenters for joining me to host this webinar today. We're just so grateful for each of you spending all of the time to prepare. And I know I've learned a ton just in the past 75 minutes. So thank you so much. And to the audience, thank you for joining us. And please do not hesitate to reach out to any of the presenters. If you look at the slides that are, oh, perfect. There's the slide that's in the deck that's on the CHCS website, and you can feel free to reach out to any of us individually if you'd like more information or have further discussion. So thank you all so much for joining us, and thanks again to the presenters. Have a wonderful day.